Hi there, I'm Laura Ivey, and my problem that I've chosen is the increased prevalence of cardiovascular disease in the Native American population in southeast Oklahoma, primarily the ages of 45 to 55 for both genders. So to combat the increasing rates of cardiovascular disease in this population, I would focus in on the particular measurable risk factors for cardiovascular disease such as hypertension, smoking, and BMI. The desired change would be a decrease in the number of members of the population that would fall in the risk factor categories by increasing access to care by proposing a mobile heart healthy clinic that goes into those communities. Team members would include the clinical leader, who I would propose to be myself as a practicing advanced nurse practitioner, that would have the clinical background and experience to lead the project and decide on what data would be measured. Technical expertise would include nurses and medical assistants who are able to collect data and can appropriately measure the data such as blood pressure. Day-to-day leadership may include someone who works for the Indian Health Services and is a member of the Native American community. Project sponsor may be an individual or physician of the Indian Health Services that is able to be a liaison between the community and the federal agency, and also specialize in secure funding for the project. So the project aims would be for clinical access to care. One aim would be within 1 year, reach 50% of the target population by the mobile heart health clinic. Increase the likelihood of utilizing the mobile heart healthy clinic by providing immediate access in the community, and reducing wait time at the heart healthy clinic by having adequate staff at the event to collect data and provide education. Established measures would include outcome measures that would decrease in average of risk factors by the population. For example, average systolic blood pressure will decrease by 10 to 20 points between the first and second visit to the Heart Healthy Clinic in 1 year. Decrease in the number of people of the population that self-report smoking, and a decrease in average BMI over 1 year. A process measure would be that 75% of the first visit patients follow up on the second visit within 1 year. For the change concept to be utilized during this project, I would focus on Toyota's improvement plan in reducing the 7 waste as it pertains to access to care. With the mobile heart healthy clinic that goes into the community, waste of transportation and waiting times are reduced for the patient. Changing the work environment would also be a part of the improvement process. Taking the healthcare providers to the patient population lowers the barriers of access to care and hopefully increases participation. Plan to test the change would be to take the mobile heart healthy clinic into Native American communities in southeast Oklahoma with 2 visits within a year of each other. On the first visit, blood pressure, self-reported smoking, and BMI will be calculated and recorded for each patient, followed by provider education on these risk factors that increase the potential for cardiovascular disease and potential lifestyle interventions to be taken in the next year. A return visit would be the same location within a year to collect the same data, along with measuring the percentage of the population that made the return visit. Testing on a small scale might include 5 communities over 1 year and analyzing the results from the small study to predict the success on a larger scale. Looking at the results and taking feedback from the patients and staff, modifications to the project would be made. Example modifications might include the hours that the mobile clinic is available and being available on more than 1 day in a particular community. Also, what type of marketing was done to notify members of the community of the mobile heart healthy clinic and how far in advance they were notified. After modifications were made and presented to the sponsor, more funding may become available to allocate more team members to reach more patients and more communities in a year span. If proven successful in decreasing risk factors in a population, a second mobile heart healthy clinic may be acquired to reach even more of the population. Thank you.